Aloha, everyone. Welcome to the Kupuna Caucus meeting this April 4th. I see Representative Chen, my co-convener. Are you on, Corey? So we welcome you to today's meeting. We are calling this meeting to order at 2 o'clock sharp. We have a presentation. Thank you, Caroline Kaderao, Executive Director. Oh, and there's my co-convener, Representative Chen. We're going to hear from Caroline on the Executive Office on Aging accomplishments, and also we were interested in what's happening with the community living kinds of programs that you have, and especially the adult care homes in the community. Is that right, Caroline? You have some information on that as well. So please proceed. Thank you for joining us and for presenting.
Well, thank you, everyone. And thank you, Senator and Representative Chen. I'm going to share my screen. Just give me one moment. My apologies. Hold on one second. I need to bring it up on my other screen. My apologies. Okay, I think we are about ready. Thank you for bearing with me during my.
Yep.
Anymore, we're starting to meet a lot more in person, and then I have these issues with sharing my screen. Can you see my whole presentation?
Yes.
It has a whole.
Well, it just has the first page, right?
Right.
Yep.
Okay. But it's not in a small setting. It's a big setting, correct? Okay, great. Let's go ahead and get started. Well, what I wanted to do today was talk to you. I'm highlighting actually our EOA's legislative report of accomplishments that we sent to the state legislature. So it recapped what we did in state fiscal year 2024. And then what I wanted to do was segue into all of the changes that are happening at the federal level in regards to health and human services and the federal impacts and how that's going to impact our aging network services and supports that we provide. So that's why I wanted to first highlight what we've done and how we may be impacted. And part of that, Senator, is adult daycare and the services that we do provide. Let me go ahead and go to the next slide. Let me start with our vision. Hawaii is the best place to grow old. Our mission is to optimize the health, safety, and independence of Hawaii's older adults and people with disabilities. And we do that through advocacy, planning, development, and coordination of policies, programs, and services. And our Older Americans Act statute and our Hawaii Revised Statutes, Section 349, are the laws that we currently follow. In our state plan, so we're required by the Administration on Aging to have a state plan on aging. So that is a plan that we developed. It's approved by what we call the Administration for Community Living. I'll share more of that later. And we develop 5 overarching goals that we agree upon, and that we develop all of our objectives, strategies, and outcomes around these 5 goals. And what I'd like to add before I get into the goals is that this is a plan of how we're using both our state and federal funds to address a comprehensive array of services and supports. So goal number 1 is Hawaii's older adults have opportunities to live well. Goal 2 is around preparing our older adults for future health threats and disasters. Goal number 3 is to ensure that our older adults and underserved communities have equitable access to programs and services, our rural population, our disparate populations, making sure that they have the same access to services and programs. Goal 4 is older adults and persons with disabilities will age in place safely. And goal number 5 addresses our Hawaii caregivers, and that's Hawaii caregivers have a broad array of services and supports to effectively care for their loved ones. And our plan went into effect October of 2023, and this runs through September of 2027. And again, this is the whole array of services and supports, both using federal and state funding. So this is our budget from state fiscal year 2024. Thank you to our state legislature and for a state that really reveres our kupuna and the work and the contributions that they've given in the past, and that we take care of our older adults. Our state budget's at about 12 million, or 60% of our overall budget. Our federal budget comes in at a little over 8 million, for a total of $20 million statewide. So we provide various, as you know, various long-term services and supports. And as I go through these, you'll be like, I know that program and I know that program. But I'd like to start first with our Aging and Disability Resource Centers that are operated by our area agencies on aging in all 4 counties. In state fiscal year 2024, we provided service on the number of contacts received by the ADRC and information out to the community was to over 42,000 individuals in our state. And we conducted over 3,000 assessments, a little lower than the year before. What we realized as we came out of the pandemic, that there was an increase in just knowing how to access information. So we saw an increase in the amount of calls to the ADRC that may not have actually turned into a need for an assessment for actual services and supports, but people looking for information that they may need in the community. So, our state Kupuna Care program, that is our program that ensures that we can have older adults remain independent in their communities for as long as possible. So in state fiscal year 2024, we provided services to over 5,500 participants statewide under the program. And as you can see by the demographics of the age breakdown, as individuals age, we know that the 80+ population, over half of those that we are serving are in the oldest age bracket. So you can see that the age bracket increases as people age. So we know that the services that we're providing are going to those with the greatest needs in the community. These are the services that we provide under the State Kupuna Care program. So what we did back in 1996, there was a report that was developed that looked at what services are most needed in our community to keep people living independently with wraparound supports in their homes. So it was described to take our state monies, because at that time, it was just all the funds, both state and federal, were used for a variety of services across the spectrum, from healthy aging, older adults, all the way to those who needed higher levels of care. But we wanted to take our state dollars, put them towards those services that we felt were the needed services to keep people in place in homes. So we selected these core services: personal care, homemaker, chore, home delivered meals, adult daycare, case management, assisted transportation, and regular transportation. And there's just a variation on the different types of transportation, and attendant care. And we had identified these were the services that, again, like I said, would keep people living at home for as long as possible. The one service that we do have, we combine both our state and federal funds, is the home delivered meals program, the programs under the home delivered meals. So you can see the number of individuals we served in state fiscal year 2024, as well as the service units that we provided. And this is statewide totals. We know that we are hitting those, we're serving those most in need. We serve over 31% are homebound. So it's very difficult for them to get out of their homes. We know that we're serving 43% who live alone, that don't have natural supports in their community. We are providing over 1,000 individuals, or 19%, are in poverty. And 30% of those that we're serving, that 5,520 individuals, have what we call deficits of activities of daily living. So that's things like eating. You have difficulty eating, or have difficulty with bathing, dressing, toileting, transferring. Those are activities of daily living. And these are the percentages and the demographics of the participants that we're serving. So you may be wondering, well, what other services? You have these state-funded services that you provide, and then there's what we use our Title III Older American Act funds for. And those include things, and this is not the extensive list, but I pulled out some of the salient ones. Congregate meals, we provided about 161,000 congregate meals to over 2,200 individuals. We provided 90,000 one-way trips of transportation. We provided over 7,000 hours of legal services in the community. We provided respite care hours of 64,000 in the year 2024, counseling and training to almost 600 individuals at 5,573 hours of service. We provided over 16,000 hours of nutrition education and over 25,000 hours of information and assistance. And under health promotion, we just count the number of individuals that we serve under health promotion. Those are our evidence-based interventions. We provided over 4,207 individuals with health promotion. This includes evidence-based and non-evidence-based health promotion activities. Again, those are all with federal funds, and this will tie into later on in my presentation. So our long-term ombudsman program is here in our office. In state fiscal year 24, they provided over 987 facility visits statewide to over 7,700 residents, provided over 2,600 consultation to facilities and providers, and provided 800 individuals and families with information and assistance. We also, and you know this, we train volunteers to be representatives. They are our ombudsman volunteers. They go out into the community. We have 16 volunteers, and we brought on an additional 15 in state fiscal year 2024 that provided outreach and shared information. They went into facilities and represented our ombudsman and provided over 1,500 hours of volunteer services valued at $53,000. And then they conducted in-person visits, and they resolved 83 out of 101 complaint cases filed. So we're very proud of the work that they've been doing. And along with the ombudsman, the increase in the ombudsman that we have, it's been, now that we have more staff, it's been really good. All of you know this, you've seen me at the state legislature talking about our state health insurance assistance program. In state fiscal year 2024, they provided over 12,000 hours of outreach. I'm sorry, no, that was 12. We provided 12,000 individuals with outreach and education. We did a 7-month analysis in 2024 and had a 50% increase to the number of calls to the helpline. As you know, there's a bill right now moving through the state legislature, House Bill 705, the Medi project. This project is going to focus on the underserved communities having increased assistance to low-income subsidy program benefits, such as SNAP, such as Social Security, such as the Medicaid Savings Program. And during that time in 2024, we saw overall contacts among underserved communities increased by 53%. We reached out 63% increase to our rural communities, our neighbor islands. 86% more Native Hawaiians sought our services, and 26% speaking English as a second language also came to us looking for help with these low-income subsidy program benefits. I'm highlighting this because we have walk-ins that come into our office. Within 1 week, we had 3 individuals sent to us from the Social Security Administration. And knowing what's going on at the federal level, we know that we're going to see a huge rise in the number of walk-ins coming to our office looking for assistance because they may not have anywhere else to go. And then our great volunteership volunteers contributed over 3,600 service hours at a value of $123,000 to the state. Our senior Medicare patrol also had great accomplishments in that year. They also reached out to over 10,350 individuals during 2023, end of 2023, which was state fiscal year 24. We launched Swap Those Scams media campaign to really raise awareness to scams out in the community. We saw such a huge rise in scams during the COVID era, and just ensuring that people know not to give out their information, not to fall victim to these scams, because it really does have an impact overall on their financial well-being. So we reached over 10,000 residents. We counseled over 330 individuals in 2024. We have some of our special initiatives. Now, this was before the legislature appropriated monies for our Healthy Aging partnership. So thank you to the state legislature. We now have in our budget monies for healthy aging, but we did in state fiscal year 2024, we were able with some of our federal funding to continue our enhanced fitness program. So we provided services to over 348 participants. And we also had Better Choices, Better Health, a 6 weeks exercise, 6-week program to help you manage your chronic conditions. It teaches you how to talk to your doctor, how to eat right, and different things. And that workshop, again, is a 6-week workshop, and we had 38 participants. These numbers, as we now have the funding for healthy aging, will go up in the coming years. And then I do want to highlight that Dr. Jack Lewin had mentioned the Veterans Directed Choice Program in one of his past presentations. The Executive Office on Aging is the provider for veterans directed care, and we've been doing this since 2015. So we actually had to demonstrate before we could become a provider for veterans directed care that we had services and supports in place and staff to manage the Veterans Directed Care Program. So we did that through our community living program. So we were allowing participants that may not do traditional services to actually manage their own budget and to get services through the community living program. That program demonstrated to the Veterans Administration that we could execute veterans directed choice. So we've been doing this since 2015. We do have a lot of turnover because we're serving veterans, older veterans that are towards the end of their life. And I don't have the numbers currently of how many we've served from 2015 till now. But in state fiscal year 24, we were serving 105 veterans that were enrolled in our program. And we expect that over this current year that we're in, that we're going to increase another 30 veterans statewide. This is a really good program. Veterans Choice allows veterans who have given service to their country to have a budget that they manage through the VA, their veterans monies that come down. And it's based on your years of connectivity. So if you know, I'll put this plug in, you're wondering, how can I know veterans out there that could possibly be part of this program. Have your veterans that you may know talk to their social worker, because the referrals need to come from the Veterans Administration to the Executive Office on Aging. And that's our Veterans Directed Choice Program. I talked really fast. I shared with you a lot of information. I just have one more, our Hawaii Dementia Initiative, which you're all aware of, thanks to the state legislature. We have a state strategic plan for Alzheimer's disease and related dementias, Hawaii 2035 strategic plan. And that engages communities and provides education and collaboration. We have over 150 community members and stakeholders across the state that really provide and move forward a lot of our goals and initiatives within our strategic plan. In 2024, we had over 3,000 individuals participate in educational programs, and we also engaged over almost 500 professionals in receiving training on dementia. So that's some of the goals that we hit in 2024, along with procuring and getting out our awareness campaigns. So very excited for our Hawaii Dementia Initiative. So before I segue to all of these changes happening at the federal level, I wanted, Senator, do I have time to entertain any questions on our programs?
Yes, why don't you have questions on the EOA achievements first, if from anyone, and then you can segue.
And I'll segue. Okay, okay.
So any questions? I don't see anything in the chat. Just raise your hands. I'll try to look for your any raised hand. Oh, Dr. Lewin.
Thank you, Senator. Carolyn, I just want to congratulate you and your team. We're working closely together between SHPTA and EOA, but we really think that you guys are doing some dynamic things, and we look forward to maybe setting up some pilots to improve home health services and innovation in the workforce shortage in the future. But it's really a great pleasure working with you guys. Thank you for all you do.
Yeah, we love working with you guys too. You know, we both have small offices, so you know, the more we can collaborate and come together, the better.
Thank you to both of you and to collaboration.
Yes.
Anyone else? Okay. Well, I don't see any hands, nor anything on the chat. So Caroline, why don't you proceed?
Oh, there's actually two things in the chat here. Hold on.
Oh,
that's that AI stuff. Sorry, no, sorry. Let me go ahead. Yeah, there weren't any questions in the chat.
One new message.
The reason I wanted to highlight our accomplishments, and I'm very proud of my staff. I'm proud of our area agencies on aging. We have a cohort of providers throughout the state that are the boots on the ground providing the services. So it's a team effort. It's the whole aging network for our caregivers, for our participants, the older adults that we provide services for. I'm not the best one to toot our horn, but the reason I did it is because I wanted to segue to changes and impacts by the federal government, what's going on right now. And we found out that on March 27th, that the Department of Health and Human Services announced a reorganization, they told us, of the Administration for Community Living. Again, that's where our state plan goes up. That's where our federal dollars come from. We have a regional office. We're part of Region 9 that we go to when, maybe we need to discuss policy, programming, get guidance and clarifications. And they proposed a restructuring. This was to be in alignment with the DOGE objectives, streamlining efficiencies and consolidation. So these were the actions overall by Health and Human Services that they announced in their press conference as of March 27th, that they were going to reduce 20,000 federal employees. They were going to take 28 divisions and reduce it down to 15. They were going to take 10 regional offices and reduce it to 5. And then they were going to centralize things like human resources, IT, procurement, external affairs, and policy. And they were going to eliminate the Administration for Community Living. So this was March 27th, 2025. Okay, fast forward a few days. And on April 1st, and this was not an April 1st joke, but on April 1st, the Administration for Community Living was dissolved.
Wow.
So what I'm going to, let me explain to you what I mean by that. In 2012, by the stroke of a pen, they brought together various programs for aging and disabilities under one umbrella, which they called the Administration for Community Living. So all of these programs, such as the Administration on Aging, the Center for Innovation and Partnership, Administration on Disabilities, and the National Institute on Disabilities, Independent Living and Rehab, all have laws, right? The Rehab Act of 1973, the Older Americans Act of 1965 as amended, and different acts that were in law, but to form Administration for Community Living, they just brought it all together. And it was to really streamline and support each other. So it was a streamlined approach to really address both aging and disabilities and really look at what everyone wants, living in their community with needed services and supports. So what had happened on April 1st is we got word that everything you see here in blue was all the blue was the reduction in force. So all the regional offices on April 1st closed, and all of the top tiered areas such as Office of External Affairs, Center for Management and Budget, the administration, all were dissolved as of April 1st. What remained, because they can't strip it, are those that have laws that back it. Administration on Aging, Older Americans Act, Administration on Disabilities, the National Institute on Disability, Independent Living, and the Center for Innovation and Partnership. Those would have to go through Congress to be repealed. But everything in blue is what was striked out as of April 1st. So I'll pause there before I move on. See if there's any questions on that.
So it seems that it goes back to what it was before.
What it was before.
Yeah,
right.
like AOA.
But we always had regional offices under AOA.
So do the regional offices stay in place under AOA, or is that wiped out? Because
that remains to be seen, because and I heard in my PABIA meeting today that they've been trying to get rid of regional offices for a long time, I guess before I even realized it. But it's hard because I think all the regional offices came together to support all of these programs, right? So they all, so right now there's a lot of unknowns. My regional administrator is no longer employed. So this also affects our Title VI under the Older Americans Act. That's the programs for Native Hawaiians. So, and Alaskans. So, Aululike is also part of this, and part of the funding that comes down from the Older Americans Act. But you can see what has stayed in place. Like under Administration on Aging, we still have the Office of Supportive and Caregiver Services, the Office for Elder Justice and Adult Protective Services, the Nutrition and Health Promotion Programs, and Office of, this is the Native Hawaiians, that last office right there. Those programs are still in place because they're still considered, there's laws around this, right? So, and you can see across here the different ones under the different sectors of disabilities. So this news has been fast coming. First it was, oh, there's going to be a reorg. Then a few days later on April 1st, the restructuring. So there is a lot of unknowns. We do know, and this is where I really want to highlight, this is our greatest concern and vulnerability, is that the Older Americans Act that was reauthorized in 2020 expired in 2024. So we're waiting for that reauthorization. We can still receive federal appropriations, but it makes us very vulnerable because we're waiting for them to pass a new reauthorized Older Americans Act. With this workforce reduction, we know that there may be slow drawdown processes. We know there may be delays in our notices of awards. We were supposed to get our State Health Insurance Assistance Program award on April 1, but they couldn't get into the office to send it over to us. So we have gotten an email though that the award is coming, a partial award will be coming. It's just taking a little longer. So we're already seeing the effects of some of these things in play. Again, the regional offices are closed. So we've come together as a network of how do we prepare for the future? What does this look like? We know this is weighing on everyone's minds. We're seeing it like that example I gave earlier, where, Social Security Administration, now their offices, they can't receive calls. I think they have to only do website stuff now, but there's so many changes at so many levels, and it's leaving our older adults, people with disabilities, or anyone that's just seeking services or help or information very vulnerable. So we're looking at how can we get messaging out in a way that will be effective, that will help to guide people during these very turbulent times that we're not really sure what's going to happen. We're going to get together and really look at, when we're looking at our funding allocations, we're going to have to do some what they call scenario planning, not so much strategic, but scenario planning. If this scenario were to happen, what would we do? If this scenario were to happen, what will we do? So we're going to be kind of coming together, the county executives and myself and some of the staff, to see how can we plan around that in preparation, because things are coming so fast at us, and it's just really it's been very difficult. And then we already have 2 of 4 meetings scheduled with our congressional delegation to really ensure that they understand how these impacts will affect our kupuna and people with disabilities in the state of Hawaii, and to ensure that when they're at the table at the federal level, is to ask those hard questions. Why isn't there transparency around this? Why are we don't hear about it through anything but a press release, or an email from our regional director from her personal email, because she no longer has an email. So, it's that kind of stuff. We want to make sure that we know, I don't agree, but I mean, they're doing this for efficiency. It's just the transparency of it all is very concerning. So, and I really think that by dismantling Administration for Community Living, they're really doing a disservice to our older adults nationwide, not just here in Hawaii, but nationwide. So there's still a lot of very unknowns that we don't know about, but I just really wanted to highlight what's happening to us in the Aging Network, to the Kupuna Caucus, and to those that are really champions for a lot of the aging issues that, that we're trying to address. So, and I know all of you all have a lot on your plates too, that you have to try to figure out as we wrap up this legislative session, but just really wanted to highlight some of the areas that we're struggling with all of these changes that are coming so quickly to us.
Caroline, I do have a question.
Let me stop sharing and then I can see all of you. Okay, go ahead.
So, you heard from Dave Day from the Attorney General's office, and they've got, I don't know how many, 11, 15 attorneys general across the country that have lawsuits going. They also are collecting information on what was on focus on the DEI, but in terms of the elderly, the impact on the elderly, have you contacted the AG's office to put this also on their radar as they go forward? Because this is pulling back from services and maybe identifying the services that are really critical for our elderly and disabled. Have you?
Yes. Well, we reached out first to our congressional delegation, but thank you, Senator. Yes, I will put that on.
And you can contact Dave Day, who you met at the last meeting, and then I can give you his number too, so that you can at least put it on their radar, because this is critical, because these are the vulnerable, the elderly and the disabled. So add that to the DEI list.
Yeah, it is. It's all those people that we want to support and continue to support.
Are there other questions, others of Caroline on either the state achievements and issues, as well as what's happening on the federal side, as much as she can tell us what's happening, but it looks like a dismantling of an agency that supports the vulnerable, the elderly, the disabled.
I think Rick has his hand up. Hi, Rick.
Yeah, just raise my hand because I can lower it
Oh,
easily.
okay, hi, Larry,
And
okay.
so I know we're just in Pavia and we talked about this too, but what do you guys think, Caroline? Will there be just like everything else? Do you think there's a potential for lawsuits to block some of this? Is there precedence to do that? I mean, is this a done deal? I mean, it sounds like they've done what they've done like they always do, but do you think there's a way of going back and correcting some of this?
This
You know,
is
as
just
we
my initial thought on it,
Yeah.
and it's not. I think because ACL was not in statute. This is the part that concerns me. It's not in law.
Yeah.
I don't know if they can do an injunction like that, or
Well, and not being in statute, was it delayed in by any means? Was there a stall that happens, or what happened that it wasn't in statute? That it seems like
I
such
wish
a critical thing.
you would think, it was when I actually had to go back when we first heard about just the reorg part of it without all this elimination. I had to go back because it's been so many years. I was here in aging in 2012 when, we got the notice. I remember it was in the spring, and I remember our director at the time, Wes Lum, came and said, wow, there's this new thing that they're doing. And it was a stroke of the pen. All they did was bring everyone together. And I don't know if it just lost sight over time and they didn't create it into law, or
Well,
and
but I
that's
also think
the concerning part.
our Kupuna is such a large voting, group. I mean, are we mobilizing them to actually contact and to respond and to hopefully point out that in future elections, this is not going to get votes? I mean, how aware are we making them of this, and can we make them aware? I know we're always careful, but I think in this point, we need to take the gloves off and
Definitely
make sure everybody is aware, and everybody is not just contacting their legislators, but are contacting everybody out there with what's going on. This is it's egregious. I mean, everything to this point has been egregious, but this is actually attacking those that raised us when they need the services the most. And we're the silver tsunami that we talk about, we're long into it. It's here. This is like the worst possible time they could make these changes, and I'll stop there.
But Rick, you do bring up a good point, and we've actually been talking among the county execs and myself, and I got to give Rowana Dagdagandaya some credit because she had done a letter when this first all started, before even knowing about the dismantling, but just concerns, about what was happening overall at the federal level, and she created some documents that we're going to go back and look at to, our participants that are in our programs, but how can we use some of that same language maybe to get the word out, more at large to communities, because I don't want to instill fear, but at the same time, I think we got to be transparent as far as we know what we know.
Yeah, I always say, so we don't want to alarm people, although this is very alarming. We want to be a voice of reason, and we want to empower them to stand up for what their needs are without fearing them, not out of fear. So we can be, we're not reacting. We're trying to be as proactive as possible in a reactive time.
Exactly.
So how do we do that for that mass population out there and their loved ones that are their caregivers? I mean, so we're all in the field, we'll do what we can, but even more powerful coming from the community, if we can help them do that in a again, voice of reason kind of way.
Right.
I mean, it might be penning, this is what we think would be helpful to share with your legislators, like everybody does. You're welcome to, change that, but this is the narrative that we think could be, quite useful. This is what's happening. This is why this is. So I know I've already got one from Meals on Wheels America. I've already got one from, various different places, and I send them all the time, but that's me. It's even more powerful coming from the people that actually need the services and their loved ones. So you know, to the extent that we could do that, or anybody in here can do that with their folks, I think it would be helpful.
Very helpful, yeah.
The other thing, Caroline, I don't know, each state has an executive office on aging or whatever it's called in each state. But you have an association, right? When they do training and you come together, the network, the aging network. Have the states come together, executives from the states to actually plan out a strategy? I mean, I know this is just like the last week, so it's kind of hard to do.
Came very fast at us, but we've actually, and we have to thank them. That's our new, it used to be the National Association of State Units on Aging, and you may remember that, Senator Moriwaki. Now they're called Advancing States. They're the ones that sent that org chart that I showed you, and I didn't give them credit. I'm sorry, that was the org chart that they provided us after this announcement. They actually have been, my membership dues have been really useful, but they actually have been our voice of reason. They have been the ones that when we were told we could not talk to the federal government after the current president was elected into office, and I had no communication with the region for 2 months. It was Advancing States that we had weekly calls, weekly discussions about how to move forward with all this information. So we've been sharing examples, different things, and that's that messaging stuff, Rick, that we were talking about. So there's been different states share what they've been doing around this, and we've actually, and it's been in conjunction with the National Association for the Developmental Disabilities Division also. So we meet weekly Tuesday, 9 a.m. So they've been really the backbone for us these last few months because we've just had no communication with the feds.
It'd be good to get from them sort of talking points on what areas are being cut in terms of program. We know that different organizational units are cut, but in terms of what that means for services directly given to seniors or disabled would be really important for that kind of information to go out to the public.
Senator, I think right now, because they're just doing those federal cuts for efficiency, right? They've done that, and we're seeing that across, right, multiples. But we know the next step is now what do those budgets look like? Those service dollars that are coming down to the different states, to all the states, right? And I think it's going to be the second round, and that's why we have to prepare for that.
They're not cutting services, they're cutting staff, is that?
Right, they've cut staff, but that doesn't mean that next they're going to be looking at budgets. That's what I'm projecting.
Well,
but
what was the $880 billion in federal dollars that they cut that they still have?
Oh, thank you, Rick, for
right.
There's been so much information coming out of us. I forgot that. There was a reduction of 880 billion. What I was told that some of that money that would have come to ACL, we did not take a reduction in our federal dollars for federal fiscal year 2025, and we have received all of our funding that will get us through September 30th of this year. The portion that would have come from that
880 billion, yeah.
880 billion for the Administration for Community Living, former Administration for Community Living, was earmarked special funding that the ACL did not ask for. So it wasn't actually for our appropriations that come down to each of the 50 states. That's how I read the email, Jack.
So the regular funding is still intact, is what you're saying?
Right now, but my concern is not having the Older Americans Act reauthorized. That puts us vulnerability going into federal fiscal year 26.
We're still waiting for the Senate version. So the House proposed the $880 billion cuts. That would be about $300 million a year for MedQuest in total. That would have to be made up if we were going to keep the same benefits, beneficiaries, and programs. So, but the Senate has not yet opined. So, I mean, but it's looming, and Senate leaders today said that they were going to support approximately that kind of a cut. They didn't specify how they're getting there altogether.
Hmm.
Not good.
Yeah. Are there any other questions or comments? Well,
I didn't want to be doom and gloom, but I think we really
mean,
have to kind of
reality,
get ahead of this
you know,
as we move forward.
thank you.
You know,
Any-
I've told the network too, and I've told the staff here too, is just continue to do the good work you're doing, you know, unless we hear otherwise, you know, we have our appropriations, we're still doing the work, we're still, you know, just continue to move forward, support each other, and, you know, we'll just try to
So,
keep ahead of all of these moving parts.
so Senator and Rep, was there, I heard about a bill that's to try to help with some of these cuts. Is that true? Is that still alive?
We have a bill from the Senate,
Yeah,
it was for keeping afloat any of the nonprofits that are providing
Oh.
services that are critical. We're still
Okay.
looking at the budgets, individual items, but,
and that's still alive?
yeah.
Okay. All right.
So Senator, a lot of the federal monies that go down go to a lot of those service providers in the community. So, you know, as we
A lot
know,
of
it's
nonprofits that do the actual
the actual work.
vision. Yeah. Okay, any other comments, questions? Thank you so much, Caroline. I know it's gonna be
problem.
crazy time, so,
No,
glad
the
y'all-
timing was good for asking though. At first I was like, oh, but there's some, you know, and then I thought this is a great opportunity for us to just share what we do know.
Mhm, mhm. And then as you find out more, you can let us know and we could spread it out to everyone. If you get any pieces of information, that might be helpful in terms of pursuing whatever kinds of actions we need, for the services that we don't want to have, we don't want to lose.
Right, definitely.
So the state will have to pick up. We're not sure where we are.
But as we plan out those scenarios, I mean, if you
Yeah.
need ideas on dollars or something, I mean, we'd be happy to try to provide what we can.
Yeah,
Our
yeah.
scenario
I think we'll have
plan.
to just wait and see,
Yeah.
because now if they're cutting the first layer of just staffing,
Yeah,
then we'll have to see what are they cutting in terms of actual budget that would affect services that we render. Okay, all right. Thank you so much, Caroline. Really appreciate your presenting
thank you.
the doom, but not so much gloom. We can hopefully deal with it if we know what we're dealing with. So thank
Can
you.
I add one thing? I always tell my staff, thank God we live in Hawaii. Where
Right.
people care about each other and, you know, I'll leave it at that.
Okay, well, thank you. Thank
you.
you very much. And speaking of what we're going to be funding or supporting and still alive, I'm going to screen share our Kupuna Caucus bills and everything here. Oh, proof of that dead should come off. But anyway, the Kupuna Caucus bills of the 5 that we have, the 3 bills that you see up front, the House Bill 703, which is the rent supplement bill. It was to expire this year. It's been extended through 2028. And then SB 701, our family caregiver bill, and also HB 705, which is the Medi bill. So all of them are alive. They're we heard it in WAM. It's going to the floor next week, and we are most likely going to pass those out. So it will probably go to conference, but they're alive. So not bad, 3 of the 5 bills. And then I've
Actually-
added in some other bills. Does anyone have questions or comments on those bills?
Senator, actually, there's 4 out of 5.
Or 4,
So-
which is the other one?
The one bill that wasn't part of the Kupuna Caucus package, but it was very similar to HB 702 and the SB 877. We
Yeah.
just passed it on
Oh.
3rd reading from the House, so it's going to
Oh.
conference, but it's Senate Bill 298.
298? Oh, we missed that. Okay,
And
which
it's the
bill is?
Medicaid, appropriation for Medicaid in-home services.
Oh, okay.
So
Oh,
it was
okay.
San
Can you add
Buenaventura
that in,
bill that was
Alex?
separate from the Kupuna Caucus, but that one actually is still moving.
Okay, that's Senate Bill 7, what was that?
298.
Oh, 298, Senate Bill 298. Alex, can you change that and take this proof of income out? You have it? Can you change it right on the screen? And that's an increase in fees for in-home services. Is that the one?
Yes, that's the one.
Okay. Great. 4 out of 5. That's pretty good. Okay, so then take out that income paycheck discrimination one. That's dead. Okay, so the other bills we've included here are still alive, and they all are supportive of Kupuna. So there's the needs allowance bill, it corrects the language in the bill so that it's not taken out of the needs allowance. It's a separate $75 that we allocated or appropriated last year, and it was being taken out of the monthly payment to the institution, the home. So it's separated out. And that is in the Senate waiting 3rd reading. So all of these are going to be heard next week. Cognitive assessments, this is the one. I mean, if anybody has questions, I think some of these Caroline can answer as well. The cognitive assessments is requiring Medicare or doctors who have Medicare patients to give a test, cognitive assessment, so that there can be more preventive care and screening on the front end earlier to help our kupuna or others as well. I think everybody should be taking those cognitive assessments. And in fact, the next month, I want to share with you something on brain health. But anyway, fall prevention, that's been up a lot. That finally, that bill is moving. And we have positions on dementia to the medical school to start looking at dementia, Alzheimer's. And that was, oh, thank you to the Alzheimer's Association and EOA, yesterday's advocacy day. We had a wonderful program on what's happening. And I think Senator Kim introduced this bill. She spoke on needing the positions in the medical school. And supportive decision-making is the good work of the Disabilities Commission. And this is on supportive decision-making agreements prior to or in lieu of having guardianships. So I think it's a really good supportive measure for keeping our kupuna independent and being able to make their own choices with people that they trust, rather than a guardian that's appointed. And then the resolution, this resolution is really looking at long-term care financing. It was discussed way long ago when we had a long-term care plan. And we're looking at asking the Tax Review Commission, which is meeting this year, to look at this issue of financing and whether there can be some options laid out for us to review in the future, or the Tax Review Commission can recommend. So those are, other than that, if I missed anything, please raise your hand or put your comments in the chat. Were there others?
I would just say, Senator, that I'm hoping the prior authorization process works, because for people trying to get wheelchairs and other equipment, Kupuna that need, that could be very important. And we're going to try to work out not only mandatory reporting, which is parallel to what is already, the insurers already have to report to CMS for Medicaid and Medicare. So I'm suggesting keeping the reporting exactly the same, so it's not a new work for them. But then we will have a better handle on what's happening, since CMS doesn't publish those results. And then and there are other issues that Kupuna have raised to our advisory councils where care has been denied. So we're going to work on trying to fix that and agree on standards so we can almost automate the process. But it's going to take a year or two to complete, but we think it's going to be very helpful.
Okay, good. And what is that bill number?
There are two bills in there now. One is Senate Bill 1449, and an identical bill, almost identical, a couple words, but basically almost the same bill, is House Bill 250. And the various amendments made over the course of the legislature have made both bills almost identical and much better. So very happy with that.
So there's not one that's preferred, both of them, either or, because I guess in conference.
Yeah, in conference, I think, in some ways, you kind of want to keep one off from the conference decision so that it's still alive next year if need be. But HMSA has actually come around to agreeing to participate. So I think that's huge progress that's been made there. And but these are difficult issues, but I feel very good about it so far.
Mm-hmm, mm-hmm. Well, thank you very much for
thanks for taking that
being
on.
that. Yeah. We'll add it to our list to watch. And we can circle back next meeting. The next meeting we should be wrapping up everything. So I hope all of these pass. Any other issues or questions that people have on the legislation or where we are? Okay, are there any announcements then?
Well, I'll just say, good work on all of these bills. This Kupuna Caucus does great. First coming up and vetting the bills and then actually supporting and keeping us informed. So everybody on this page, great job, everyone. So appreciate working with you all. Thank you.
Thank you. Anyone else? Okay, so the next meeting will be May 2nd at 2. I think that's Cine Day. So we can celebrate, hopefully celebrate. But I have sort of building on Alzheimer's Advocacy Day, Tani and her work with the Alzheimer dementia plan, is that I met Mari Kim, who is an architect engineer, because I was looking at Kupuna housing and how we can have a model assisted living for Kupuna, and trying to see how we can have a stimulating environment or something to help Kupuna as they age in place. And she also introduced me to Dr. Kazuma Nakagawa. And the both of them have put Hawaii on the map by their brain health work. In fact, they have tested it out with the homeless at the Ivile Center, where there are 12 questions or components that will stimulate your brain to be healthy, and it can prevent dementia, cardiac problems. And what they do is it's a brain health score, and they'll go through each one, like social activities or your physical health and what all of these items are together. If you follow their instructions or directions on how to address each of these areas, if you're deficient in any one of these areas, they'll tell you these are the kinds of things you need to do. to improve that component. So it's quite exciting because they've shown that it works, and they work with the Harvard Medical School. So it's been something that they've been working on for years. And so they're excited about helping us look at that. So I invited them to come to the May 2nd meeting, and she will go through it with you. So you can all take the brain health test and have a brain health score. And then wherever you're deficient, they have instructions on what to do so that you can improve your brain health score. So I really look forward to hearing from them, and I hope all of you can invite others who are interested, especially the Alzheimer Association people, to come on and see whether this might be something. It kind of builds on what Caroline, you folks were doing with the cognitive assessment, because it could be a model test that we could also look at if in fact it does help in terms of cognitive health. So I invite all of you to the May 2nd meeting, which will be same time, 2:00 on Zoom. And if you have any other programs that you'd like to have us present, please send it in to us. Any other announcements? Okay, then we have come to 3:00. Time to say goodbye, and have a great weekend. Aloha, everyone. Thank you all for joining us.
Hello.
Hello.
Okay, and with Representative Chan, mahalo.
Peace, Senator.